Hello, my name is Kanya Pausi Kamath. I'm from Ponda. We got associated with Dilasa due to my father. My father was diagnosed with colon cancer just in January, and we took him to Manipal Hospital, and there he was operated. After the operation, when we were told that he has to be discharged, we were not very ready to take him home, and that's how we came to know that Dilasa is one center where terminally ill patients are being taken care of, and that's how we got him here. He was treated so well, and he was that moral support which he required, any cancer patient required or any terminally ill patient required, he got here. From entering to this hospital to all the care he was given, it was a very beautiful journey. Of course, I lost my father a few days back, but the journey a few days journey which he had over here was quite memorable. We saw him we saw him traveling on a wheelchair, which we never expected, because when we saw him on bed, we thought that we would never expect him to get up, but they really gave him that support, they really gave him that confidence that yes, he can do something better, and that willpower was somehow raised. Even I remember after taking him home from Dilasa, we brought him back over here when we found him quite critical, and the 2 days which he passed here, we thought that his suffering will keep on rising, but somehow his suffering was reduced. He had his death in peace, and we saw him taking his last breath in so peace, and that gave us so much satisfaction that he didn't have to suffer so much.
मेरा नाम शकील शेख है, मैं गोवा का हूँ, पोंडा गोवा का, और मेरी मम्मी को कैंसर हो गया था लास्ट 10 इयर्स बैक, और हम लोग ने उनका इलाज यहाँ वहाँ पर बहुत जगह पर किया है, लेकिन स्लो करते वो बढ़ते चला गया इलाज। ये बीमारी जो है ना वो बढ़ती चली गई सर्विस की। जो बच्चे का जो थैली था ना उसके अंदर ये हो गया था, कैंसर हो गया था, तो उसे निकालने नहीं मिलता था, ऑपरेशन नहीं कर सकता था, लास्ट स्टेज था, फर्स्ट स्टेज था। तो हम लोग ने जीएमसी बाद में बहुत से हॉस्पिटल दिखाया तो क्यूर नहीं हो, तो वो घर पे ही रहती थी। ज्यादातर पेन होता पेन किलर पे ही डिपेंड रहती थी, हॉस्पिटल में ज्यादातर कुछ ये नहीं था। तो अब हम लोगों ने यहाँ पर तलाश किया कि कहाँ पर अच्छा ट्रीटमेंट चलता है या कोई टेक केयर करने वाला ऐसा है हॉस्पिटल बोल दो। तो मेरे फ्रेंड के जरिए मेरे को पता चला दिलासा है बोल के है, गोवा में पोंडा है, आईएमओ है। तो वहाँ पर हम लोग ने इमरजेंसी था बहुत, तो हम लोग ने एक कॉन्टेक्ट के जरिए किसी फ्रेंड के जरिए हो गया मेरा काम, तो हम लोग यहाँ पर आ गए। आने के बाद में यहाँ पता चला कि यहाँ पर ट्रीटमेंट करते हैं कैंसर पेशेंट्स, ओनली फॉर कैंसर पेशेंट का है। तो हम लोग ने यहाँ पर स्टार्ट कर दिया। मम्मी को लेके आया मैं, कोविड के दौरान ही लेके आया था। तो यहाँ पर आके उनका टेस्ट हो गया, बाद में यहाँ पर पूरा अच्छी तरह से इलाज हो गया। डॉक्टर्स अच्छे है, नर्सेज अच्छी है, सब लोग बेस्ट है, और घर से बेटर यहाँ पर है। एटलीस्ट यहाँ पर रिलीफ मिलता है उनको। वहाँ पर घर पे ओनली पेन पे रहते हैं, यहाँ पर एटलीस्ट नर्सेज से, सिस्टर से, डॉक्टर से अच्छे से बात करते हैं, प्यार से बात करते हैं, तो उनका इम्प्रूवमेंट ऑटोमेटिकली होता है। तो दवाई से ही इम्प्रूवमेंट नहीं है, प्यार से बात करने से भी इम्प्रूवमेंट होता है। तो अच्छे से अम्मी एकदम फ्रेश होके अच्छा होके चले गए थे। तो वन ऑफ द बेस्ट दिलासा ट्रीटमेंट दे रही है यहाँ पर। तो मैं चाहता हूँ कि ऐसे जो पेशेंट है जो घर पे ही रहते हैं और उनका ठीक तरह से देखभाल नहीं होता है, तो यहाँ पर आके उनको आराम से एक घर जैसा ही है। यहाँ पर सब लोग डॉक्टर ट्रीटमेंट भी मिलेगा आपको, प्लस आपका इलाज भी हो जाएगा और फ्रेश फील करेंगे, घर से बेटर है। आप चाहिए तो कभी भी आ सकते हैं और कभी भी जा सकते हैं, ऐसा भी नहीं है कि आके रहना ऐसा ही कंपल्सरी नहीं है। जब अच्छा लगा आप घर पे जा सकते हैं, फिर से आके आपका इलाज हो सकता है।
Dr. Vandana Patankar. I am a Chief Medical Officer of this Dilasa Palliative Care Centre. Since it started in 2019, I am here as a main medical officer. I am the one. Okay. So I am handling the patient, those who come for OPD, those who come for admission, and those who are at home visit also I am doing. So all kinds of patients are seen by me. OPD patients, they come here, those who can walk back home, they come here for medicine, maybe monthly medicines, painkillers and whatever they need for monthly basis or weekly basis. And those who need admission, then we admit them in our ward And those who cannot come to the hospital, we give them a home visit at their place on their request along with my team. I got the nurses and social worker, and so we go as a team and we handle them at home.
So, as a Chief Medical Officer of a palliative care center, what are the challenges that you encounter and how do you deal with it?
As a palliative care is a entirely new thing, and it requires lot of patience and lot of expertise in a different way. Because here the most of the people, they come with mostly the terminal stages when they have exhausted all the hopes of getting cured. So for them, each day, for us also, each day is important. So whatever life they have left, we have to make them comfortable and add value to whatever days they are remaining. So because the others doctors have written them off and they say don't come to us now, we have finished the treatment. But here we cannot say like that. We say you have come here, good, we will make you comfortable. Whatever your pain, mostly people come here with the pain and other symptoms. So that is our, we have to tackle with their physical issues, then their psychological issues, then their social issues, spiritual issues. So these all are combined together, then we have to handle it. Whereas in general OPD, we just see the patient, we write treatment and we send them. It is just it is that kind of work. But here we have to sit with the patient. We have to take all these 4 issues into consideration: physical, psychological, social, spiritual. And not only patients, we have to handle the relatives also, because they are also going through a lot of stress because of their near and dear one is sick and suffering, and they feel that they are helpless, they cannot do anything. But whatever can be done, we tell them whatever, still nothing, not totally, it is not a loss. So whatever life they are remaining, so that we will make them comfortable so that they can say goodbye in a peaceful way.
Okay, myself Sunu VS. Basically I am a caregiver. I did my BSc in nursing, and I did specialty in palliative care, and since 4 years I am working in palliative care, and I have been here in Dilasa Palliative Care recent 1 year.
Myself Taluka. I am a BSc staff nurse over in Dilasa Hospital from November 2020. I joined in 2020 November, and from there I am working here in Dilasa.
So, for both of you as a nurse, how challenging it is to deal with palliative care patients who are at their last stage, they are not able to do things for themselves. So, then their caretakers or their relatives also come. So, how do you manage their physical needs, their mental health issues? How do you tackle these situations?
Well, first of all, what the major thing we are facing is their relatives, they are not accepting that patient is in end of life. And most of the person, they will think like the patients can pull through it. So there is a major thing, and we are dealing with multiple time counseling with the caretaker. And once the patient want to know what is happening to the physically, then we are explaining to them they are in end of life. If they have any wishes or something, we are ready to fulfill, and we are ready to support to the patient. And most of them, they are feeling it is not a physical pain. Most of them are feeling with psychological pain because of their thinking of their children, their education and their future. So those kind of thing, most of time we couldn't even find any solution for that. But we are just giving them advice for that how they can go to.
So how do you find this situation? This physical need, medical science teaches you, but emotional reactions, the behavioral issues that may happen. Sometimes patient may take out their anger on you. It may not be directed at you, but it is you are facing it. So how do you deal with this kind of situation?
We just stay calm and explain to the patient that we provide psychological support to the patient, and deal like if they become anger, we'll be calm and explain them that this is the situation, and we have to like we give treatment like this, and this is the thing that we do.
here. And the most of patients, what they are suffering is they are keeping their all emotions inside. And once they are getting a chance to open their mind, and they will start to shout, and then they will realize that, and then they will start to cry, and then they will cope with their situation. And when we are dealing with those kind of things, there is one painful touch that is enough for the patient. So then they will adjust with our care, and then they will come to the reality, what we are seeing in our experience.
Once we get adjusted, then they become adjustable with us and they become calm with us.
So what is the message for people who come here and people who are may aspire to do nursing here? How challenging is doing nursing in a palliative care center than in a normal hospital or a nursing home?
It's entirely different because they couldn't find what they are really expecting. It is entirely different one. And we are with the patient all the time for how they want to manage at home, and how they want to fulfill their physical needs, and how to be with them emotionally. And we are just teaching them about how to give a proper personal care, and morning care means like bed bath and sponge bath, hair care, oral care, and how they can take them out with wheelchair support, and how they can be like a wheelchair friendly patient. And those kind of things we are dealing like a normal nursing care.
So what have you learned from all these experiences? How has it made you? Has it made you more aware, more matured? How do you?
Really, it's really a good experience with us for dealing a palliative care patients, because most of the time when the patient is coming with an angry face or crying face, and when they are leaving from here, they are giving a nice smile to us. And because most of the patients are not suffering with their diseases, it is secondary to their disease, and we are giving very well symptom management like pain management and their constipation management. And most of the patients are not ready to open their mind, because if we are asking details about their constipation history, they will feel like shy, or they will feel like we are something diverting from the management side. But it is not like that. It's relevant to our management, palliative care management. And so we are good with that. And it's nice experience, because when the patient is in end of life, we are ready to fulfill their last wish. So that is very effective for the patient, and most of them, they are on their way of going also. They are very thankful to our palliative care and our team. And most of
I'm working as a pharmacist at Dilasa Palliative Care Centre, and we are handling here the narcotics, mainly the morphine injections, fentanyl patch, and
So when it comes to medication for palliative care patients, how different it is from normal pharmacy or normal general hospital pharmacy?
usually we dispense here narcotics and most of the surgical items, such as catheters, all the surgical items, and all the records are maintained for narcotics, drugs, etc.
Okay.
I am Dr. Usgaonker, chairperson of Ponda Charitable Trust. Dilasa is a palliative care unit of Ponda. It is run by Ponda Charitable Trust. When we thought of palliative care was in infancy. There were only 0.4% of the people who deserve palliative care is to get it. There were only 36 institutions which was handling the palliative care at that time. We were 37th. Now there are 150 institutions which are registered and taking care of 1% of the deserving patients who require a palliative care. See how much gap is there. We have to cover up almost 99%. In our busy practice, we found the society, it is not very well happy with with the palliative care given in the state of Goa. And the near and dear ones had a problem in getting the palliative care. The family disturbance was there, so and that rightly create a problem within the family, and there was a family conflicts. At the same time, there was a disturbance in the family in total. So we thought, why not start a palliative unit in Goa? We thought in terms of having a palliative unit in the whole of Goa of 25 beds, and we went into that direction. We got the land from the Commandant of the 5,000 square meters, and we acquired the land, and then we started construction, and the construction was done from the donation. Donation initially came from doctor community, where we could build ground floor and the foundation and the structure of the ground floor. First and second floor came from the mega philanthropist donations, then the philanthropists and well-wishers within the state of Goa, and the MP Land Fund and the Goa Cancer Society. At present, we are running only 10 beds in the palliative care and taking care of the patient who come to us, referred from either GMC, from the Manipal Hospital, KLS Hospital or Tata Memorial Hospital. We give palliation in the form of in a complex, it is a multidisciplinary process where the patient is given care to suppress their symptoms, and overall treatment is given in the form of a pain and other management. We have altogether about 24 employees with us. They work round the clock to give palliation and palliative care.
I am Dr. Subhash Shikerkar. I am the treasurer of this trust for almost last 9 years. When we thought of this project, we had approached our challenges of the trust from day one, finance only. When we thought of this project, that time we approached the mine owners and other big people. But that time mining was banned because of some problem, and the mine owners, they just promised us to help provided the ban is lifted. So there was no question of that type of help or any help from the mine owners for our project. Then we approached the philanthropist, we collected substantial funds and we started the project, and somehow we could complete the project with a delay of around 4.5 years, which was supposed to complete within 2 years, but it took around 4.5 years to complete the project. We inaugurated a project, we gave employment to around 24 employees, and actual problem started when the question of giving them salary every month and helping the patient by way of medicines and food. So we had to go to the public every now and then. We had only few people who are contributing regularly, but to a small amount. And we can't get big funds or corpus because of financial constraints all over. Subsequently, last year the COVID started, and it was a time for us to actually prove ourselves whether we can continue or not, because the money flow was almost negligible and we had to exhaust whatever corpus we had, which is not advisable actually to spend a corpus and get ourselves exhausted. Our actual salary of the staff is around 4 lakhs per month, and the patient's food and medicines and other maintenance charges come to around 3 lakhs per month. So around 7 lakhs is the amount we need minimum per month to run the project very smoothly. But because of COVID condition, as our collection or the receiving the donation has gone down, we appeal the public, because by way of we need at least 3,500 to 3,500 rupees at least per day per patient to run the project very smoothly. So here is an appeal to the public to help us by way of funds, every person at least 3,500 per day, and one person can help for one day, and subsequently their friends and families, they can appeal and they can raise some funds, and if they help this institution by way of helping the patient daily, then we'll be able to run this project smoothly. We are also appealing the government to help us, but government's position is also, as they claim, that it is not that good. The government has been promising for last 3 years, but we have not yet received a single paisa from government as a help, by way of help. Even this year, the government has assured us of the help, but that is not helping us. So our appeal to the public is help by way of raising funds themselves and their relatives and friends, so that we can run this project very smoothly.
We just gave you a glimpse of how this palliative care center in Ponda, Goa, named Dilasa, under the aegis of IMA Ponda is functioning, and how it is proving to be a boon to the people who are in the terminal stage and don't have any proper formal care to be given at home. And this shows that there is care always out there for you. However, this facility which is being provided, providing all your services for free, but all still comes at a cost, and that cost is entirely borne by this facility. And it urgently needs support of the masses to help render its services to more people who are in the terminally ill stage, so that more people can benefit. This is Shashwat Gupta, Parliament, India.